Greetings, everyone. My name is Steve McPhail. I'm the founder and director of OET Online. And today we're going to look at techniques to help you create a clinical, objective, and formal writing style. So let's begin. The first thing we should look at is the OET Assessment Criteria. So this clinical and formal writing style that we're trying to develop can be found in the writing assessment criteria and level descriptors. Now, one of the descriptors, genre and style, it actually says writing is clinical, factual, and appropriate to genre, right? So it's one of those assessment criteria that we see here. It's appropriate to genre and the reader, discipline and knowledge. Technical language, abbreviations, and polite language are used appropriately for document and recipient. So that really means that the language you choose is appropriate for the medical genre. And so when we say clinical and factual, means, well, clinical, that's the terminology, the medical terminology used to summarize patient symptoms, procedures, and so forth. Factual means you're just presenting the facts and you're removing any emotive or flowery language or casual expression because it is a formal writing. So that's what it is. It's not the same as an essay that has different elements in it and different type of words that you may use. The really important thing about medical writing is it has to be clear, right? And that brings us over to conciseness and clarity, right? So if we look here, length of document is appropriate to the case and the reader. No irrelevant information included, yes. But particularly length of document. How do you get a document to fit into that 180 to 200 words? Well, you need to be able to summarize effectively and present that information clearly. So again, we can see that's actually connected to writing in a clinical and factual manner. Now, you're going to need some technique and good vocabulary in order to do this. So the two big areas that we're looking at when we try to formalize our writing is, we really are looking at conciseness and clarity and genre and style. So to score well in these areas, we need some real skills, and that's what I'm going to give you a little bit of a taster today so you can work out and incorporate that into your own writing style. Make sure you got a notepad and pen handy. Take notes, learn, and then apply to your own writing. Let's get cracking. So there's a technique which we call nominalization. And that means turning verbs and adjectives into nouns to help create a professional writing style suitable for medical communication. So how does it work? Well, let's have a look at these sentences that I have up here. We analyzed the data from the experiment and it revealed that children react when they have too much sugar. Right, so we got analyzed. So if we nominalize it, the analysis of the data. So we immediately removed the subject we. The analysis of the data revealed children's reaction, react becomes reaction, and then to excessive sugar intake. Too much sugar, it's an adverb there, and it's informal. It's a little bit emphatic, which is not good. So children's reaction to excessive is neutral, excessive sugar intake. So all of a sudden it's formal. You'll also notice that the word length is almost half. So we've been able to reduce word length by writing in a formal manner, right? That's very important. That's what we need to be able to do. As a result, we've got greater clarity and conciseness. It becomes more formal, and it sounds clinical, objective, and professional. All those elements, yep. Objective means factual, right? So clinical, objective, factual, and professional. We're removing the actor from the sentence in that process as well. Here's another example. The medical team decided to stop the treatment. A decision was made to stop the treatment. So again, we removed the medical team because it's not as relevant. The most important thing is the decision. We discussed whether it would be beneficial to see a specialist. A discussion was held regarding the benefits of seeing a specialist. So we've removed the subject we here again, and we've turned beneficial adjective into the noun benefits. Okay, the verb see becomes a gerund seeing. All right, that doesn't mean that we sometimes don't include us in the subject. It is possible to include yourself when you want to express your opinion where appropriate. But a lot of times you want to focus on the procedure or the patient rather than yourself. So using passive structures aligns closely with that objective and professional style, and also links well with nominalization. Okay, let's dig a little deeper, everyone. So we got no fever, no cough, no runny nose. So we saw in the document before, you want to use appropriate technical language. So what's technical language for no fever, no cough, no runny nose? Patient was asymptomatic. So you've got 6 words or 7 words into one word. And we can write that as Mrs. X was asymptomatic, right? Just showing you how to use that expression. So that's using the appropriate technical language. No fever, no temp, afebrile. Mrs. X was afebrile, right? You could join it into one sentence. Mrs. X was asymptomatic and afebrile, and then you may add extra information. Symptoms suggest acute colonic pseudo-obstruction. Now, we got this verb suggest, right? But we might want to write that in a formal style, so we can use suggestive of. The symptoms were suggestive of an acute colonic pseudo-obstruction. Few things going on here, everyone, to pay attention to. So were suggestive of is very nice language. It's a formal style. We could also use a synonym, were indicative of. That also works. So there's other words you can use, but they're nice patterns, formal style. And notice how we've used an acute pseudo-colonic colonic pseudo-obstruction. Now, of course, in the case notes, the articles are removed, but it's your job to add them where required. All right, so just be aware of that when you're doing it. It's a type of obstruction, an acute colonic pseudo-obstruction, so we need that article. Now we've got an example, perhaps this could be considered a dentistry example, tooth 26, sensitive to hot and cold, not too serious. Whenever you see inverted commas like that, it means that's language, that's words that the patient said. Doctor, it's not too serious. Doctor says, or dentist says, how would you describe the pain? Not too serious. And that's what you'll see in the case notes. But your job is to then turn that into more objective and formal language. So sensitive is, in this case, is an adjective. So we'll turn it into a noun, sensitivity, not too serious, mild. We put that together. The patient reported a mild temperature sensitivity. So hot and cold, you know, that's temperature. So a mild temperature sensitivity. So that's a formal writing style. We're using the article mild temperature sensitivity because it's a type of sensitivity, right? In this case, a temperature sensitivity. So there is a pattern where we use articles when we have an adjective before a noun. Okay, let's look at the next one. So back in 2022, 2 of 26 permanently restored. That's an action. Someone restored it, adverb and a verb. But we can turn that into an adjective plus noun pattern, permanent restoration. Permanent restoration of 2 of 26 was completed on this date. All right, so the case notes don't have the verb complete, but that's been added by the writer. Again, formal writing style. Next one. Mr. Z complained of osteoarthritis in both knees for many years. Okay, so we need to formalize that, and there's a few words we want to formalize here. Have a think about it. How would you do this? Is there a technical term for both? All right. How are we going to express this duration here for many years? So what technical term or clinical term would you use to describe arthritis that has existed for many years? Well, let's check it out. So we can say, look at this, a history of chronic bilateral arthritis. So if you've had something for many years, it's chronic. If it's in both knees, the technical term is bilateral, right? So we got this pattern, a history of. So when we write that out, Mr. Z reported a history of chronic bilateral arthritis. Now we have a formal writing style. It's formal, it's clinical, it's objective, and it's the way that health professionals write. This is a style you need to master. It doesn't matter if you are a doctor, a dentist, a vet, a physiotherapist, a pharmacist, or a nurse. The writing style is the same. You can work within the technical areas of your particular profession and the language associated with it, but medical writing is the same for all genres. So, sleep disturbed, last 3 nights, woke up with pain. So, the noun of disturb is disturbances. All right. Now, pain is one word, woke up with pain, but you could use pain, but there are synonyms. In this case, we're going to use discomfort. Mrs. Y has now we got last 3 nights. How are we going to do that? We can use the word recent, right? A recent history of. We could also say a 3-day history of if we wanted, but a recent history is quite a good summary. A recent history, it's happened recently, of sleep disturbed. So we can change it into sleep disturbances and discomfort. So we've used original language. We're paraphrasing the case notes. We're borrowing some words from the notes. You should always borrow, but we need to modify, don't we? We need to go from verb to noun, adjective to noun, and so forth. So make those adjustments, and where appropriate, use synonyms. Now, another important area when you're writing a set of case notes is the formal time-related expressions. Remember, when you're doing this, you're describing a patient history over a period of time. So you can't write a referral letter without incorporating formal time-related expressions. So look, we've got consultations. There were 2 consultations on the 21st of June and the 25th of June. So 2 consultations. And in the case note, you'd have information about each consultation, what the subjective findings were, what the objective findings were, what procedures, whatever happened on those visits. But we removed them from here just to demonstrate. But sometimes you don't want to write a paragraph on both consultations. You might, because the information might be connected and it might be easier to summarize 2 consultations into 1 paragraph. That's also going to help you manage your word length. So if we had 2 visits, we can say 2 separate occasions, and we write a sentence, Mrs. X presented at the clinic on 2 separate occasions over the past week. So we've captured the time period over the past week, presented, came to the clinic, and then 2 separate occasions is the 2 dates there. And then you can then capture the rest of that information in the paragraph. So this would be the first sentence of the paragraph. In a sense, it's like the topic sentence. It tells the reader what you're referring to. Now, Mr. Y, confused sometimes. Sometimes is a bit informal, so we don't want to use that word. At times, much better. Mr. Y reported that he experiences confusion at times. So there's 2 good things going on here to formalize your writing. One is the verb experiences. We experience confusion. We experience pain. So this is good collocation. Verb plus noun, formal style, formal writing style. And at times is much better than sometimes. Just formal expression to add to your writing. Right? Sometimes, particularly if you're a pharmacist or a vet or some of the allied professions, you need to write advice to a patient. For example, exercise every day. That can become on a daily basis. It is important that you exercise on a daily basis. So now we have that formal writing style. Even if you're writing to a patient, you may use less technical jargon. If you're writing to a patient, you should, but you're still presenting information in a formal manner. Now, I just want to show you the reverse of that. We can also denominalize. So that means you might see something written quite formally. You can also go backwards and then turn the nouns into verbs and adjectives. You might need to do that when you're writing because you need that flexibility with language. Remember, you're paraphrasing the case notes. So while it's common to go from a verb or an adjective to a noun, the reverse can also be done to fit in that sentence structure that you've created. And sometimes as health professionals, you want to add your voice or opinion because you're the ones providing the treatment, right? It's not wrong to do that, right? But you have to be judicious, careful, depending on who you're writing to, because you don't want to influence, if you're writing to consultation, their opinion. So it's quite common just to present that information objectively. Okay, but let's look at how we do that. Gluten-free diet until resolution of symptoms. So this patient must need this type of diet until resolution of the symptoms. So we can turn the noun resolution into resolve, and we can write the patient, now have a think about it, something gluten-free diet. So they haven't given a verb, we're going to have to add a verb. The patient was placed on a gluten-free diet. So that was placed on by the health professional. We're focusing on the patient. We've used the passive form was placed on. Make sure you add that to your vocabulary list. So you place someone on a diet until her symptoms resolve. All right, nice formal style there. We could also say the patient was instructed to follow a gluten-free diet. We also follow a diet. Okay, next one, biopsy results, characteristic findings of flattened intestinal villi. So findings, we often use the verb indicate or reveal, right? These are findings, but we want to turn that into a verb. The biopsy results indicated or revealed flattened intestinal villi. So we've changed the order. The biopsy results indicated or revealed, right? When you're using results, make sure you use a verb like indicated or revealed. Don't use reported. We can only use reported for people. X-rays, biopsies, ultrasounds, they don't report. They indicate or they reveal. So just be aware of that. Assessment required before commencement of therapy. So assessment required, but the verb of assessment is assess and commencement is commence. So if we are making a request, we can use a polite form. Could you please assess Mrs. Y before therapy is commenced? So now we've put commencement into a verb before therapy is commenced in that passive form there, before therapy is commenced. It's a nice formal style, but it is a request, so we've used a verb. Okay, so look, we've just looked, it's a bit of a taster, everyone, of what you need to do. If you want more information like this, then this is what we do in our live classes that we're always teaching on our website every day of the week, Monday to Friday. But what I think you can do now is just work on that range of professional vocabulary and expression so you can develop that clinical and objective writing style that you need in that criteria I mentioned earlier, genre and style, clarity and conciseness. Don't be the casual guy at the beach relaxing. That's not it. Be the formal person, the formal health professional. Learn to write like that. And your score, you'll get more points and your score will go up. Now, at OET Online, we are a premium preparation partner. So we have all of this excellent content to help you. We're fully endorsed for all 12 professions. So it doesn't matter if you're a dentist, a nurse, a vet, a podiatrist, a radiographer, a dietitian, pharmacist, speech pathologist, a physiotherapist, a dentist. What would this one be? Helping an occupational therapist or an optometrist. Doesn't matter which one. We're fully endorsed for all of those professions, everyone. We do offer a free taster course. So here's our website link. Come and visit it. You can get a feel for what study is like at OET Online. We are an all-stars provider, which means that we have reached the top of what's required to deliver these lectures on our YouTube channels. And if you want more information, if you've got your phone, everyone, scan that QR code now. That'll take you directly to the website. You can send us an email if you wish, info@oetonline.net.au. Be happy to provide advice regarding courses and how we can help you. But yes, check it all out on the website. Great range of options, really budget friendly, and short or long durations, whatever you need. So join our community of health professionals achieving success in OET. Well worth it. You don't want to do repeat attempts in this exam if you can avoid it. We can help you succeed more quickly than doing it alone, and help you build that confidence that you need. And good news, everyone. At the moment, if you're watching this between July 1 and July 14, we have a clinical communication skills sale. So there's 10% off site-wide, all our course 10% off for you. And this is your path to OET success and a career as an international health professional. So use the promo code CCS sale, right? So when you go to pay for your course, if you've chosen to enroll in a course, if you put in these words CCS sale, a little promo code place on the website, it will automatically reduce the price by 10%. So go for it, everyone, and join us, and I'll see you in class. I have a passion for teaching OET, so you will always see me teaching different lectures on the website. Hope to see you soon. Bye for now.